Ted Kennedy, a driving force behind healthcare legislation. Senator Kennedy, obviously suffering from brain cancer. He's on the cover of Newsweek magazine. He's written an essay, and in it he writes this: quality care shouldn't depend on your financial resources or the type of job you have or the medical condition you face. Every American should be able to get the same treatment that U.S. senators are entitled to. This is the cause of my life. It's a key reason that I defied my illness last summer to speak at the Democratic Convention in Denver to support Barack Obama, but also to make sure, as I said, that we will break the old gridlock and guarantee that every American will have decent, quality health care as a fundamental right and not just a privilege. Is he a driving force in this debate that will prevail in the end?
Well, we all love Ted Kennedy, and we wish him well and hope for his recovery. But we don't necessarily agree that his particular prescription is going to bring about quality health care for Americans, for all Americans. We'd all like to do that. The problem is the direction in which the Democratic majority seems to want to go and the president wants to go would basically put the government in charge of our health care. We've had an experience with that already, with government-run automobile companies. Ford Motor Company makes automobiles in my hometown. The CEO called me up recently and he said, we're doing reasonably well compared to everybody else in this recession. People appreciate the fact that we haven't taken any money from the government, but we got a problem. The government now runs the finance companies of GM and Chrysler. And since they're running the finance companies, they're undercutting us on the financing of our automobiles. Sound familiar? When Secretary Sebelius says that there will be more competition if you have a government-run insurance company, there will be no competition. The government will, with the backstop of the taxpayers, undercut the 1,300 or so health insurance companies we have. We won't have any competition at all. Pretty soon the doctors and the hospitals will all be working for the government. And the notion that this will be cheaper, I'm reminded of what the humorist P.J. O'Rourke said. You think health care is expensive now, wait till it's free.
Although it's pretty expensive now.
It is.
And there are issues like rationing that the Republicans bring up that goes on now when private insurance companies say you can't have certain things covered. That already exists.
Not like it would if you had a government plan. I had a friend of mine in Florida who called up recently and said he just lost a friend of his in Canada because the government decided he was too old for a certain kind of procedure, and apparently he didn't have the money or the ability to get down to the United States for quality health care. I don't think that's the direction the American people want us to go, David.